everyone, welcome back to my YouTube channel. My name is Charity. This is part 2 of my nursing journey. So in part 1, I talked about my journey from the academic standpoint. So I talked about like the schooling and all of that. So I'll link that video below if you haven't watched it already. But basically, yeah, it was more about the academic component. But in this video, this is part 2, and I'm going to be talking more about the bedside and nursing experience in itself. I started working as a registered nurse January of 2016. Specifically, it was January 6th, 2016. That was when I started working as a registered nurse. January 6th, 2020, I am officially 4 years old as a registered nurse. And it's been an interesting journey. I really thank God. But within that 4 years, have had the opportunity to work in 4 different nursing specialties. The first specialty that I worked in as a registered nurse is in a long-term care, often also known as a nursing home. It is a large facility, and oftentimes older people are the type of population that you'll find there. So older people that are not able to take care of themselves, older people that have like Alzheimer's, dementia, which are cognitive diseases that makes them to oftentimes forget even who they are and who their loved ones are. And over time, that disease actually progresses, causes the patient to just lose their ability to really function and to comprehend cognitively. And so a lot of the times, a lot of families will put their loved ones in a place like that because nursing homes are often employed with nurses, licensed practical nurses, as well as registered nurses, and even physicians who will come in and really manage the health care and manage the care of these people that are there. So in a nursing home, most likely you're going to find a lot of older people, 65 and over. But sometimes you'll actually find younger people as well. Like I've taken care of, I think, like an 18-year-old before, and this was a young woman. She just had some very unique challenges, and so the family will just put them in a nursing home because they know that they're going to receive the medical care and the personal care and basically all-around care that they need. And so yeah, that was my first experience. I worked in a nursing home for about a year and almost 6 months, and then I left. In the nursing home as a registered nurse, you can have from 15 patients to 40 patients. At some point, I was the only nurse on a specific unit, and that unit was a 40-bedded unit, and that specific day I had 38 patients. Yes, okay. So imagine having 38 patients. You're responsible as a nurse for administering medication to all of those 38 patients. You're responsible for making sure that they are safe, ensure that you're performing any treatments that are ordered, which means if they have any type of wound care or if they have any type of respiratory treatments, whatever treatments are required, you as a nurse are responsible for it. And then you're also responsible for your aides. So your nursing assistants, you're responsible for delegating. A lot of the times, many nurses' aides, they have been working in nursing homes for a really, really long time, and oftentimes they've been working on a specific unit for a very long time, so they know what they're doing. But sometimes you just have to make sure that certain things are put in place and that certain things are done the right way as the registered nurse, because at the end of the day, you are responsible. In a nursing home as a registered nurse, you play a lot of roles. The second area of nursing specialty that I've worked in is pediatric private duty nurse, also known as PDN, private duty nursing. I specifically work with the pediatric population. I take care of patients on a one-to-one basis. The most patients I've ever had so far at a time is 2, and that was because I had a set of twins, and so they both needed nursing care, and so I was their nurse. So basically with pediatric private duty nursing, children that are born with a lot of health challenges, and because of that, their health challenges necessitate nursing care. and a lot of the nursing care is taking place in the patient's homes. So oftentimes with pediatric private duty nurse, you're going to be in the patient's home. I remember the first time I went into a patient's home for the first time, to take care of them. I couldn't believe it. It was like a mini hospital, and it was so cute, but it was also very interesting because I had never seen anything like that before. But I've really grown to really like this type of job because it's one-on-one care. You can spend time with the patient. You can have enough time to take care of them. You're not under any type of stress. It's also in a home environment, and so I really like it. Some people don't like it, but personally I really like it because it comes with a lot of benefits. Of course, there are some cons which I look forward to address in future videos, but there are a lot of benefits as well to private duty nursing or just home health nursing in general. I've been working in PDN for almost 2 years. So the third type of nursing specialty that I've worked in is in a clinic, in a women's pregnancy clinic. I love pregnancy. I love women's health. I think that it is so important. Our body is so intricately created by our great God, and the fact that a woman's body can receive a seed and nurture a seed and then give birth to me, it is absolutely incredible. And so I worked at a pregnancy clinic, and basically the goal of the pregnancy clinic was to educate women and provide young women with resources that will prevent them from actually getting an abortion. And I did it on a volunteer basis. I wasn't paid for it, but I love it so much that I was willing to do it for free. So as a nurse, what I would do is that when a young woman comes in, first of all, we need to confirm that the pregnancy is viable. So she will do a pregnancy test. Once I confirm that she's pregnant, then we provide her with resources, with pregnancy education, what she should eat, what she shouldn't eat. And also make sure that we connect her with a healthcare provider within the community so that she can be monitored by the healthcare provider. We want to make sure that the pregnancy is healthy. We also want to make sure that this young woman is surrounded by support and by resources that she can easily tap into so that she's not pressured to go and have an abortion. And so I really enjoyed that place. I worked there for a few months. It was a really great experience. I really loved it. A lot of the times what happens is that the organization kept record of the young women that actually went on to have their babies, and so they'll call and follow up with them. And it's always so beautiful to hear that they had the baby and that the babies are doing well. It's always really exciting. So I loved it. The organization also provides even clothes for the babies and diapers and all these different things. So yeah, I loved working there. The other thing that I really liked about the pregnancy center was that it was a Christian-based organization. And so every young woman that came into that facility got to hear the gospel. There were counselors who were responsible for counseling them, and one of their roles was to preach the gospel to these women. And so I really love that. And so that was just like a little contribution, to the gospel of Christ, and really just, supporting this organization to be able to propagate the gospel of Christ Jesus. So the number 4 nursing specialty that I have worked in is oncology. And I have to say that has to be the toughest nursing specialty that I have yet to work in. Oncology was difficult. Oncology nursing is the care of patients that have been diagnosed with cancer, patients who are going through cancer treatment or at the end stages of their cancer. I had a lot of, patients that were just newly diagnosed with cancer, and of course, cancer is not a fun news for anybody to hear. And so just emotionally, I've seen patients cry. I've also seen patients die. I've had patients that died. Emotionally challenging specialty of nursing, but it was also spiritually rewarding because it was an opportunity for me a lot of the times to be able to share the gospel with a lot of the patients that were at the very end stages of their disease. At that point, a lot of them are very open to hearing the word of God. And so I preach to them, and then I pray with them, and I pray for them. And so it was a very, very rewarding specialty of nursing. I worked in oncology for a year and a few months. And then I left and I went back to PDN, which is what I'm currently doing. I worked in a hospital in oncology. The minimum amount of patients that I could have in oncology was 4 patients. But even though it was 4 patients, these were patients that were very, very sick. These were patients that, I mean, their care is so critical that even though I have 4 patients, it feels like I have way more than that, you know, because of all of the care that is required, you know, for these patients. But I thank God for the opportunity to be able to work on all of these nursing specialties. If y'all have any questions at all regarding these specialties, please let me know. And in the future, by God's grace, I plan to go into a little bit more detail about all of these specialties as well, and explain a little bit more about the nurse's role as you get into these specialties of nursing. Alrighty, thank you all so much for watching, and be sure to join my Facebook page. It is called Nursing Realities. What you should know before becoming a nurse. If you're interested, I'll leave the link down below. Come over and join us. Let's all learn together, you know, let's educate the public about nursing, and let's educate ourselves as well about nursing, and let's take care of ourselves. You know, nursing is all about holistic care, mind, body, spirit. Well, I will talk to y'all in the next video. Thank you so much for your support, and God bless. Talk to you later. Bye.